Take it from me, what I used to do was, and sadly I did this as a student, because I was familiar, I moved on. I didn't realize that I should just go back and see what else I can grab from that topic. If I did that, I do that now, but if I did that then, I would have learned a lot more faster. A lot of us are familiar with tetracyclines. We know buy a 30, sell a 50, but we don't know, for example, this term. We don't know that doxy is given to people who have allergies to penicillin, but by adding more content, you'll be able to solidify more information. And then it forces us to go over this one. Nucleic acid synthesis looks like a good answer, but it's wrong. It's Metro. Metro is Metro drug that we give. Metro is given for Giardia, Entamoeba histolytica, Trichomonas, and the beautiful mnemonic before we go is get Metro out of the way. So what I do is I highlight this, copy and paste it. I put in my first aid. Here it is. And automatically you get everything in the book that has Metro in it. So I love using first aid in this way because it really is nice. You save time and you really get everything that you want out of the way. So this case, metronidazole, you know the mnemonic get GAP. G is Giardia, Entamoeba is E, Trichomonas is T. GAP is very nice to know. Gardnerella, anaerobes, which we talked about. And you know what? In H. pylori therapy, if a person is penicillin allergic, you give Metro instead. Wow. So you know, doxy is given to people who have penicillin allergies. We give Metro in triple therapy if they have allergic to penicillin. And then we decided, we talked about below versus above the diaphragm. Above the diaphragm is clindamycin. Below the diaphragm is Metro. We know Clinda is buy a 30, sell at 50. It's a 50S inhibitor. So you see, by doing this, that's how you become ready for an exam like step 1, because it really is like ER and surgery. Quick response, immediate results. You put 5 minutes in, you get results. Other things like concepts, you learn it today, you forget it next week. That sucks, right? Become more efficient with your studying. Metro, this is the MOA. It forms toxic free radical metabolites in the bacterial cell wall, that in the cell that damages DNA. I know a lot of you know this drug. A lot of you maybe know the adverse effects, because obviously we know with alcohol, you get this reaction, but they won't give you that on the exam. They'll talk about metallic taste. They'll ask you about maybe a person has penicillin allergies, or they might give you something like this, or they'll give you one of these organisms here, bugs or viruses or parasites, and you have to know what the answer is, okay? So practice this way. What I usually do a lot in my QBank is I use a lot of my first day, like I show you here. So do yourselves a favor, please give me feedback, hook up on the office hours if you can, access the QBank videos. You'll have access to that. Let me just show you some quickly before we go. Let me just jump in here a second and show you, because I care for you guys. Here you go. Ready? This is this online community. Bottom left is everything here from the online community, accessing everything here. You have anything you want. All the communication live is here. The live Zoom session, this is where the schedule is. So we're at week 7 right now. Week 8 and week 9 is coming up. The recorded sessions are always provided here for 2025. Now, some of you want 2024. You'll have access to that by next week.